If you've ever looked at a health insurance quote and wondered what all the different options actually mean, you're definitely not alone. Terms like inpatient cover, outpatient cover, hospital lists, excesses, therapies, and cancer cover can make choosing a policy feel far more complicated than it needs to be. That's exactly why I've created this guide. I want to help you understand how health insurance actually works, so you can make an informed decision about the cover that's right for you. Let's start at the beginning. Many insurers now include access to a remote GP service. This allows you to speak to a qualified doctor, often by phone or video, usually within a matter of hours or often the same day, rather than waiting days or weeks for an appointment. While it isn't intended to replace your own GP, it can be incredibly convenient for medical advice, private prescriptions where appropriate, and referrals to specialists when needed. Private prescriptions aren't covered by the plan, just to be clear. The next thing to consider, which is quite important, is the hospital lists and access you will have. Every insurer has a network of hospitals where treatment is available. Some policies provide access to hundreds of private hospitals across the UK, while others use guided or restricted hospital lists to keep premiums lower. If you live in or around London, you may also have the option of including access to top central London hospitals and specialists, like the Cromwell and Harley Street, although this isn't something everyone needs. However, should you need to be referred there, it's nice to know you have access. Understanding which hospital list is right for you is an important part of choosing the right policy. Next, let's look at one of the areas that causes the most confusion: outpatient and inpatient cover. Think of outpatient cover as everything that happens before you're admitted to hospital. This usually includes consultations with specialists, diagnostic tests such as MRI, CT, or ultrasound scans, blood tests and investigations that help diagnose your condition. The amount of outpatient cover included can vary significantly between policies, which is why it can have a noticeable impact on the overall premium. Inpatient cover is the core of most private health insurance policies. It pays for treatment where you're admitted to hospital, whether that's as an overnight patient or, in many cases, as a day patient having surgery. Day patient treatment is also included for smaller procedures where you are in and out on the same day. Depending on your policy and the insurer, inpatient cover typically includes your hospital accommodation, operating theatre costs, surgeon's fees, prescribed drugs and dressings used during your treatment, nursing care, diagnostic tests carried out during your admission, and the cost of eligible surgical procedures. In simple terms, it's designed to cover the major cost associated with receiving treatment in hospital, giving you access to private care without facing potentially significant medical bills. Another area people often ask about is cancer cover. Most comprehensive private health insurance policies include extensive cancer benefits, covering eligible treatments such as chemotherapy, radiotherapy, surgery, and ongoing cancer care where medically appropriate. However, the level of cover and access to certain treatments can vary between insurers, so it's always worth understanding exactly what's included before choosing your policy. Many policies also include cover for therapies and rehabilitation. Depending on your insurer, this may include physiotherapy, osteopathy, chiropractic treatment, or other therapies designed to help you recover after illness or injury. It can also be included as part of your overall outpatient limits. Mental health support is also included on many policies, although the level of cover can differ between insurers and plans. You'll also find that many insurers offer optional extras. These can include benefits such as dental treatment, optical cover, travel insurance, or additional well-being services. They're designed to enhance your policy, but they aren't essential for everyone, so it's worth considering whether you'll actually use them before adding them to your cover. Another feature you'll often come across is the policy excess. An excess is simply the amount you agree to pay towards a claim before your insurer contributes. Choosing a higher excess will usually reduce your monthly premium, but it's important to choose an amount that you're genuinely comfortable paying should you ever need treatment. These are typically paid once in the policy year and not per claim like car insurance. One thing I'd always encourage people to remember is that choosing private health insurance isn't about buying every available benefit. It's about selecting the right combination of cover for your own circumstances, your budget, and your priorities. For some people, comprehensive outpatient cover and access to specialist hospitals are essential. For others, a more affordable policy that focuses on strong inpatient cover provides excellent protection at a much lower cost. There isn't one policy that's right for everyone. The best policy is the one that provides the cover you actually need without paying for benefits you'll never use. Throughout this guide, I'll explain each part of private health insurance in plain English, answer the questions I'm most commonly asked by clients, and help you understand how all these different options fit together. My goal is simple. By the time you've finished reading, you'll understand what you're buying, why each part of your policy matters, and feel confident choosing the level of cover that's right for you, your family, or your business. If you'd rather talk it through than work it out on your own, get in touch. I'm Aaron, thanks for watching. And remember, clear answers lead to confident choices. I'll see you in the next video.